So I'm going to scan the room. There's your stuff down in the corner and a paper on how to wash your hands on the wall. Hi, my name is Leah. I'm going to be your student nurse for today. I close the door for your privacy and I'm going to wash my hands. I can look at your wrist and have you state your first and last name and your date of birth.
Lauren Rivera, 9/24/96.
Okay, I'm going to ask you a few questions. Do you know where you are today?
UMD Mercy.
Do you know why you're here?
Let's get an assessment.
Okay, and do you know what year it is?
2016.
Okay, so based off of that information, patient is alert and oriented times 4. Are you in any pain today? And do you have any allergies? Okay, so patient appears stated age with no signs of visible illness. Patient is well groomed with her hair up and out of her face, and there is no body or breath odor. Patient is happy, calm, and cooperative, sitting up straight and alert. Speech is clear with no slurring, and affect is appropriate for her speech, her responses. So now I am going to start with your head to toe. Is it all right if I touch your head? Okay. So I'm looking for any lesions or parasites or bumps. The hair is evenly distributed. There are no lesions, parasites, or bumps. Her head is normal cephalic. So I am going to then move on to your eyes. So by just inspecting them, pupils are round, symmetrical, and even in size. They are about a 3 millimeter size, and then I am going to have you focus on my hand, and I'm going to shine light in your eyes. Okay, and then if I could have you follow the pen line. Okay, so patient reacts to light and accommodation. And if I could have you pull down your eyelids. Okay, looking at the conjunctiva, there are no signs of conjunctivitis and it's pink with no drainage. Then I am going to move on to your mouth. I'm going to have you open your mouth and say ah. Okay, so uvula is midline and goes up when you say ah. Your tongue is pink and there are no lesions and it's intact, along with your oral and buccal mucosas. Those are also pink and moist with no lesions. Teeth are white with maybe a few cavities, and the gums are intact with no bleeding. They're pink as well. Your tonsils, have you gotten your tonsils removed? Okay, so tonsils are absent. And so then I am going to move on to your face. So patient's face is warm to touch. The skin is intact with no lesions. If there were any lesions, I'd use the ABCDE method. If I could have you close your eyes, I'm going to touch parts of your face and just let me know what I'm touching. Okay, and then if I could have you open your eyes and clench your jaw. Okay, and then if I could have you smile for me, raise your eyebrows, and puff out your cheeks. So cranial nerves 5 and 7 are intact. Face is symmetrical, and nose and lips are midline. So next I'm going to move on to your neck. So I'm going to palpate your carotid arteries one at a time. Okay, next I'm going to auscultate them using the bell side. Now if I could have you hold your breath. Okay, you can breathe again. Next I'm going to move on to your upper extremities. If I could have you place your arms out. So patient's skin is warm to touch, and there is no lesions, skin is intact, hair is evenly distributed, and color is appropriate to ethnicity. I'm going to feel your brachial pulses. Those are equal bilaterally 1+, and then your radial pulses are equal bilaterally 2+. If I could see your finger, capillary refill returns within 3 seconds. There's no signs of clubbing. Nails are cut. They're strong. They're smooth. And if I could have you grasp my fingers Patient is able to grasp and has a strong grasp. Next, I'm going to move on to your heart. Using the diaphragm. So I'm going to first start at your aortic, which is the second intercostal space, right sternal border. And then your pulmonic, which is the second intercostal space, left sternal border. And then the herbs, which is the third intercostal space, left sternal border. And then the tricuspid, which is the fourth intercostal space, left sternal border. And then the mitral, which is the fifth intercostal space, midclavicular. And then I would stay there for 60 seconds and listen to the apical pulse. And then when I'm done with that, I would move to the bell side and go back from the mitral to the tricuspid, to the herbs, pulmonic, and aortic. So there are no abnormal heart sounds. Heart sounds are clear. And then I would move on to the lungs. So if I could just have you take some normal breaths, that would be great. Okay, if I could have you turn, and I'm going to listen to your back side. Okay, so lung sounds are clear, no adventitious sounds. And then I'm going to have you, no, you can stay there. I'm going to percuss the costal So if I could have you tell me if you have any tenderness. I'm going to place my hand here and then hit. Okay, and same with the other side. Any tenderness there?
No.
Okay, if I could have you bend over a little bit, I'm going to assess your spine. So the patient's spine is straight. There's no signs of any abnormal curves. And then you can sit back over. Patient's AP diameter is 2 to 1, and there are no signs of barrel chesting. And then I'm going to move on to your abdomen. So if I could have you lay down, I'll pull this out. Okay. You can move. I'm going to bring the computer over here. So I'm going to first inspect the skin, the umbilicus is midline, there are no lesions, skin is intact, contour is flat, there's no signs of scarring. And then I am going to auscultate your vowel sounds, starting with the right lower. Okay, so vowel sounds were present. And then I'm going to percuss, looking for any tympany or dullness, starting with the right lower. And then I'm going to palpate, using 3 fingers. Is there any tenderness as I'm doing any of this? No? Okay. And there are no bumps or anything abnormal in there. So then I'm going to pull your shirt down. I'm going to name 3 organs in each. The right upper has the gallbladder, the liver, and the right kidney. The left upper has your left kidney, your stomach, and your spleen. The right lower has the appendix and the right ureter and right ovary. And the left lower has the sigmoid colon, the left ureter, and the left ovary. So as you are sitting back up, I'm looking for any signs of JVD, which there are no signs. And then I'm going to start with the lower extremities. So patient is warm to touch. The skin is intact. There's no lesions. Did you shave your legs recently? So there are no hair on the legs. I'm going to look for any edema in the legs or in the ankles. So there's no signs of edema. And then I'm going to find the popliteal pulse. Popliteal pulse is unable to assess. And then I move on to the tibial. That is about, they're equal bilaterally at a 1+, and then your dorsal pedis, if I can have you take your socks off. Okay. Your dorsal pedis pulses, they're also equal bilaterally at a 1+, and there is some nail polish on here, so I'm going to use the sides to test for the capillary refill. Capillary refill returns within 3 seconds, and then I'm going to perform the Babinski test using tip of my pen line. I'm going to go from the heel to the pinky to the big toe. Heel, pinky to the big toe. And her toes did not flare, so the Babinski test came out as negative. And then if I could have you stand up and then walk from side to side in the room. I'm assessing the patient's gait. The patient's gait is steady and straight. Arms swing a little bit, but that's fine. And then, did you have any dizziness as you stood up and started walking? Okay. And next I'm going to perform a Romberg test. So if I could have you put your arms to the side, your feet together, and close your eyes for 20 seconds, and I'll be standing right here just in case you get dizzy. So 20 seconds is over. You can open your eyes. So patient is able to stand straight with a little sway, but that's normal, and no signs of dizziness. So you can have a seat, and that is the end of my head to toe.